Okay, so hi everyone. I am Sneha, and I lead the business development and sales at Glyphic. I primarily work with Aishwarya on speaking to NGOs, understanding if Glyphic is the right platform for them to explore, and we hold these monthly webinars to tell people how Glyphic can be part of their programs. So this month's focus is on health. So through this webinar today, we're going to talk about certain use cases in the health space. We will showcase some demos as well. And if you have any questions, please feel free to use the chat window. We'll also open up the floor for questions if you have any. So you can, ask your questions. So yeah, over to you, Aishwarya, if you can also give a quick intro about yourself. And for other people who are joining in, would request you all to rename yourself, your name and your organization name. And you can also, put in the chat window as well. So yeah, Aishwarya, over to you.
Thank you, Sneha. Hey everyone, I'm Aishwarya, and I mainly assist Sneha, and I'm a part of the biz dev team here at Glyphic. So yeah, just like Sneha said, we speak to NGOs to understand their uh, problems that they are facing when it comes to communicating with their beneficiaries, with their users, and then accordingly suggest them the right kind of solutions and see if technology is something that could actually help create a better impact altogether. So yeah, on that note, Sneha, I think, yeah, we can begin.
All right. I'm just going to share my screen. Just 1 second. Aishwarya, can you try sharing the screen? I'm sorry, I'm not able to find that option. Yeah. All right. Can see you too on the screen. That's fine. Okay. All right. We can start off. Okay. All right. Welcome everyone to our monthly webinar, which is Intro to Glyphic. For this one, it's health. Aishwarya, can you just take us to the next slide, please? Okay, so what we're going to cover today is we'll talk about 3 use cases. Give a little bit of introduction about what Glyphic is and what does it do. And then we move into the use cases. We're talking about 3 use cases today. One is Arogya World. The other one is CMHLP and Sneha. Then move into demo of the platform. We have sorry, Shweta, can you take us back? Yeah. We have a small demo of the platform just for you to see how Glyphic works. And then we'll just also discuss in general what are certain possibilities for NGOs that are in the health space. And if you're thinking about WhatsApp chatbot as a solution, what are certain things you should consider before you move into implementing this as a solution for your programs. So yes, so that's how the flow is going to look like. Feel free to use the chat window for any questions that you have. We will also open up the floor towards the end for any questions, and you can ask any questions that you have towards the end. So would also request everyone to consider this space as an open space for posting any kind of questions. Don't think that this is going to be a silly question, but use this space in a way that you get your answers to all the questions that you have. So yeah, Aishwarya, let's move to the next slide. Before we begin, just a small quiz for for us and for people around to understand if you already know about what WhatsApp chatbots are. We're just going to do a quick poll. Aishwarya, can you just run in the poll? Yeah, if you can just select one of the options, will just let us know how's the, yeah, okay. Okay, all right. I'm just going to end the poll here. Okay, thank you everyone for sharing. I can see a range of people here, from people who don't know about what it is to a medium yes, and to quite a few folks actually know what it is. So, but we'll just because the new folks on the team as on this group as well, we'll just tell you a little bit about what chatbots are. Ashwarya, can we move to the next slide? Yeah. Next one, please. Yeah. Okay. So two things when you think about WhatsApp. So WhatsApp, a you would have used WhatsApp to communicate with your friends, family, and your close network. And that is basically through your smartphone. It's an app-based service, and that's one bit of what WhatsApp does. So basically having communication with smaller groups or having one-on-one interaction. So that's what WhatsApp app is used for. So it's for personal use. The other one that we have is WhatsApp Business API, which is WhatsApp chatbot. So it's a platform based. And it has it usually it's usually used if you have to have conversations with multiple people and one-on-one, for example, right? So if you want to chat with one-on-one but at scale, so that is when you can use WhatsApp chatbot. So one is if you want to have one-on-one conversation with a smaller group, you use the first option. If you want to have one-on-one conversation with, let's suppose, 1,000 people, and we want to send timely messages to all those 1,000 people, respond to all their needs, all their questions in a timely manner, then this second option, which is WhatsApp Business API, is something that you should think about. You should consider. Okay, so that's the major difference between the two. What exactly is the bot? It is a software application that helps you to automate your conversations. So if you already are having one-on-one conversations with your people, but you want to do it at scale, and it's a repetitive conversation every time with those users, you can automate bit of those conversations and save your time and bandwidth. And but still you can have that kind of a personal touch with your users through WhatsApp chatbots. Okay. Okay. So Glyphic is an open source WhatsApp chatbot builder. Through Glyphic, so basically Glyphic is basically a web-based platform that we provide to nonprofits to help them run their WhatsApp chatbot with their end users or end beneficiaries. And Glyphic is currently being used by more than 100 NGOs. And one of the top sectors that we cover is education, health, and civic. So these are our top three sectors that we cover. But it's not limited to only the sectors that we are talking about. If you have a need of having a communication channel through WhatsApp with your end users, and you want to run your program at scale, you can think about using Glyphic for your users. Okay. Yeah, before we just deep dive into the real world use cases, I'll just see if we have any questions around what chatbot is. Please feel free to unmute or type in your questions if you have any. Or you can raise your hand too. So Just pause for like 5-7 seconds. Okay. All right. So now in the next section, what we're going to talk about is we're going to talk about the 3 use cases. I'll hand it over to Aishwarya for this section, and she will take us through these use cases. Aishwarya, over to you.
Yeah, thanks, Neha. So the first use case that we are going to talk about today is our Arogya World use case. Arogya World has M diabetes, meaning mobile diabetes program that they have. They reached out to us when they were finding it difficult to reach to a larger number of to reach to a larger number of people, where they wanted to actually create this behavior of sorts where they wanted the users to keep track of their diabetes problems that they're facing, create a behavior around it, where they wanted to make sure that the users keep taking medications according to the problem that they have. And yeah, so that is when they decided to use a chatbot in order to make sure to reach to thousands of users through the help of WhatsApp, where WhatsApp is considered mostly common in most of the urban and peri-urban and rural areas as well. So how their design was here, it speaks of the kind of design that they implemented and the kind of impact they had and the kind of reach that they were able to do. The design of the program were basically they were trying to reach out to their users through messages and voice calls. It was a combination of both, which was sent twice a week for a period of 6 months. This was a pilot program that they decided. And a total of 57 messages were shared with the user, and it was in 12 languages, all regional languages included. And they also had voice calls that they were doing separately, not through the WhatsApp platforms, but they were doing it in 5 languages. So it was 2 different programs clubbed into one. And the kind of impact that they found out by doing this is that they saw a 20% increase in the behavior, where people were eating more fruits in a day, more vegetables in a day. They were avoiding high fat foods, any behavioral aspects that leads to increase in diabetics, were easily being avoided with the help of the behavioral um, that they were able to implement. And with respect to this, they were able to reach to approximately around 1.5 million people across 8 states. So this was the Arogya World program. We have a small QR code here. I'll show you how their program works in general. Just give me a minute. How their flow works, basically. Initially, they try to collect a lot of information about an individual to understand the gender, the age of the person, the kind of the kind of job a person is in, their name, and all of these basic details to create a profile for him or her. And then post which they keep sending messages, like I mentioned, 57 messages spread across the entire month, where that helps them, that nudges them. So it's always there, right? All of us are very much so much involved in all of our lives and day-to-day activities that we forget to take care of ourselves. Hence that small nudge that they do on a daily basis helped people keep track of what they are eating, what they're doing on a daily basis. So the entire flow starts with something called as a keyword. Um, that is very normal when you want to have a conversation with a bot. I am keeping it very basic because there was a mixed group of people who did not know what bot is. For people who already know, please bear with me as I'm sharing redundant information. So keyword is something that triggers the flow, as in triggers the entire WhatsApp conversation that you have with the bot. So here in their case, the keyword was just a simple hi. So when I say hi, the flow gets triggered and it says welcome to Arogya World Diabetes Prevention Program. So they are doing this right now in collaboration with Bangalore International Airport. Hence they have put in their name. So you can get an option to select the language that you are comfortable with, there where there is a list of options given. And I'm going to say English since I'm comfortable with English. Once you say English, and then it starts taking your consent, because for the next 6 months it is going to send you regular messages in on a daily basis. So it requires your consent for the same, and it is always better to have this as a good practice even when you try and implement it as part of your bot. And once you give your consent as yes, it asks you for your basic details to create your profile, and your age, your name, and things like that. So with the help of these details that you have shared, it creates a profile of yours. So every time now it sends you an information, it will be a more personalized information, keeping in mind that you are a female of this particular age, what is your risk of getting diabetes, and what should be the kind of foods, and what should be the kind of lifestyle that you should be following. And on the basis of that, it sends you health tips and nudges on an everyday basis, right? So then it starts giving you an everyday nudge to create a behavior of sorts. I'll pause here. Any questions so far? No? Okay. Um, just a second. So that was about Arogya World, which gave you a demonstration of how you can, collect details from the user and then use that to create a profile and send personalized information or nudges on a daily basis in order to create a behavior of sorts. So the next use case that we are going to talk about is Nai Disha. So Nai Disha is not very particular to health of sorts. They are in multiple spaces. They are also in education. They're also into health, where they mainly help people with disabilities, right? So when it comes to disabilities, there is very less knowledge out there for caregivers, for parents, for teachers, on how to handle certain disabilities and what are the kind of health insurances or programs or uh, treatments that are available for certain kind of disabilities. And so Nahi Disha is a platform that helps people understand all of this. So yeah, you can go ahead and scan this QR code. Um, and I will also open and share my screen to make you understand how the flow works. Um, uh, yeah, you can give a thumbs up on the chatbot if on the chat box, sorry, if you have scanned the QR code, and so I can shift to my WhatsApp screen. Were you able to scan the QR code?
You can either share a reaction or thumbs up or type yes in the chat box. Any of those two work. Thanks, Rani. Thanks, David.
Great. So shall I
Thanks,
share my
Rani.
WhatsApp screen or?
Yeah, sure. Please go ahead. Sure.
One second. Right. So for Naidisha as well, the keyword is hi. I mean, they are two different organizations and they are two different numbers. So both of them, in order to make sure the flow is simple and accessible for all, they've made sure to stick to a simple keyword that everyone normally sends on a usual conversation. So when I say hi, so since I've already registered previously, it is directly not asking me for a consent or my details. It's asking me how it can help me today, remembering that I'm already a person who's enrolled into their program. So they have two different programs. One is Know Your Rights, which is basically an entire knowledge base of different kinds of health insurances, schools, government schemes, etc., that can, help students and children with special needs. And the other one is a helpline of sorts, which can connect us, the users, to counselors who are looking for some guidance on how to deal with what. So when I click on a particular, let's say I want to know my rights, this is an example of how you will be able to give in or send information. Now we saw registration. Now I'm showing you an example of how you can send content dissemination, is what we call it in technical terms, how you can send personalized content on the basis of choice of the user, right? So once I say I want to know my rights, it gives you the details of what is available for them. So since we have, when you say you want to know your rights, and it depends on the kind of state you're from and everything, it gives you an option so that it can give you a more personalized content. But let's say I am not in any of the states and I am from Karnataka, I can always say my state is not listed. So it gives you an option of central government schemes, which is applicable across India. So now I can choose a particular module that I would want to look into, or I can actually go through the entire program as a whole. But let's say I don't want to go through the entire course, and then I say I would want to choose a module. It asks me the topic that I want to know more about. For example, an overview of what Know Your Rights is, or the constitutional rights, or education, or healthcare and therapy, etc. Like, let's say I would want to know more about healthcare and therapy. Now, if I say healthcare and therapy, it gives me a voice note and also text. So this is accessible. This is readable by those who are specially able themselves or also caregivers. Hence the two option of voice notes and text. So having an accessible, is the audio audible? An affordable healthcare service is your child's fundamental right. This module explores healthcare services and rights for persons with autism and other developmental disabilities, focusing on accessibility, affordability, and equitable care for a healthy life. Right. So whatever was given in the form of a text is also sent as a form of a voice note for easy accessibility. And then if I want to know more about support groups that are available or type of treatments, I can select choice. So no, you see that the choices are getting more and more personalized in order to send in more and more personalized content to you. So for when you say you would want to know type of treatments, hence since the treatments depends on the kind of disabilities an individual might have, it sends you an image. with respect to different kinds of disability, speech therapy, audiology, occupational therapy, right? And what are I hope it's clear. What are the different methods, benefits, and objective of each of these therapies, right? So this is and also it gives you an external link that is it's a video that's available on their website that gives you an in detail explanation of how to deal with what kind of treatments, right? So and then you can go ahead and read next. This is a classic example of content dissemination, of how you can use choice based medias like images, videos, and also use voice notes to disseminate your content. I'll pause here. So far, any questions? You can feel free to unmute yourself or also put your questions on the chat window. Do we have any questions, Neha?
No, we can move forward. Sure.
Right. So the next use case that I'm going to talk about is um, a mental health use case. So we are covering different kinds of subcategories under health just to keep it as a broad option and just so that people relate to it better, since health is a very broad category. So CMHLP is a Center for Mental Health and Law and Policy. They got in touch with us very recently, where they wanted to understand how bot can be used for counseling purposes. And we have developed a demo flow of sorts, which is not fully live. So we are still, making it better. And yeah, so on that note, you can go ahead and scan this QR code, and I can show you how the bot runs on in the backend while you're interacting with this. Yeah, you can drop a yes or a thumbs up once you scan the QR code.
Aishwarya, can you take us to the flows?
Yeah, sure.
Thanks, Rani. Thanks, Tanish.
So this is our Glyphic dashboard. This is something very similar to how a WhatsApp web looks like. So, right. So I can see Tanishq, um, Nidhi, all of you have started interacting with the flow here. So here the keyword is, if you've already scanned the QR code, you will get an auto-populated message called mental health. Once I say mental health, it says that it's a counselor and how can I help you today? Um, I'm just gonna say something. I'm not scared, but yeah, just putting it out there to see what kind of responses that we might get. Um, let's say I am feeling scared. So it says, I understand that you're feeling scared. Can you tell me more about what is making you feel this way? Um, I am confused because no one's responding. And I'm not sure if people are understanding what I am saying. Um, is the actual feeling I have right now. So I went ahead and put that across. Let's say what it has to say. We have integrated AI to this in order to make sure we give it a personal touch. So it's a mix of both. So okay. Okay. So yeah, so you see that there is it is like it is answering like an actual person and it does not feel like a bot. It is understanding your problem and asking you more questions in order to understand your problem in a better way so that it can give you right kind of solution. Right. So it is a mixture of both where we have also added one knowledge base of different kinds of issues that people face when it comes to mental health, anxiety, depression, where there are a lot of solutions for these. And then we have integrated it with AI in order to make sure we understand what is the exact issue that we are facing. So it's a combination of both. It asks you questions to understand your problems and then gives you a solution from the knowledge base that we have added. So how it shows in the dashboard, this is how. So on the chat window here, it shows all the kind of conversations that an individual has had. So just the way I had it on my WhatsApp, it gives you an entire conversation history of how it looks like here. So I'll pause here. Um, do you have any questions until now?
Hi, Aishwarya. Nidhi this side.
Hey,
Uh,
Nidhi.
Sorry, I joined a bit late, so I missed the introductions and all. But the thing is, my question is now GPT also does the same thing, right? It asks you and it gives you solution if you're even tackling with mental health or any other query that you have on health. So
Mhm.
suppose I ask that, okay, I'm having a headache, and so you'll ask me, okay, these are the solution. Do you want to know something else? And chatbot also, we are using AI also to do the same thing. So do you think it will become redundant in some couple of years, that whether we'll be using ChatGPT, people will be using ChatGPT more, or because the thing is, even if we use a bot for our readers or our customers or whatever, then we are not giving them customized answers. Like it has to be, for example, somebody has a very specific query that whether this medicine should not be used or not, the response will be general. Either we use chat gpt or we use bot, right? Until and unless there is a team of people that has been dedicated to answer this question in a proper way. So my I'm it's not a question, I'm just observing this thing, and this an observation only, that how is chat gpt different from employing the bot basically. Yeah, we'll redirect our entire database of readers to this, but I just wanted to understand.
Great, great. Thank you so much, Nidhi. It's a great question. Actually, a lot of people fail to understand the difference between two. The moment I say AI can also be integrated. Um, One thing that I would like to mention here is so ChatGPT gives you answers from the internet. So internet is an ocean of solutions, and and the kind of answers that you're looking for depends on the kind of question that you put in. So it could give you answer to the point, it could give you answers something that is not right. There is no way where you verify stating that the answer that you've got is right or not. So you will blindly go ahead and say, okay, this is a solution that I got, okay, great. And the second point is ChatGPT is an entirely different application where the kind of NGOs that have partnered with Glyphic, at least as far as I understand the NGO ecosystem, a lot of people are not very technically strong. So there is a need for people to shift to a different application to go ahead, and put in their questions. So these are the main, there are a lot of other differences. These are the major two differences that I see. So since WhatsApp is a very normal communication channel used by a lot of people today across the globe, if I might say, so it becomes easier to converse. And the second thing is, when I say that we are integrating AI as well, there is, like I said, there is also a document of CMHLP, their laws and policies and solutions. Once they so AI is integrated only to give it a personal touch, where the person who's interacting with the bot feels that they're being heard, they're being understood, and the bot keeps on asking questions. So if you see this conversation history here, it is asking, I understand that you're facing this, but could you please, let me know what exactly is the point. So it keeps on asking more questions to, bring down to a point where that understand that this is the kind of problem that you're facing. And then it gives you a solution from the document of CMHLP that has been uploaded in the backend. That, okay, once it diagnoses it as depression, for say example, it goes to the document under depression and fetches the right kind of solution and provides it. So that is one way. And it also has a possibility where, you can also bring in an actual live counselor to the platform, where you raise a ticket and say that this is a problem that is not being solved by me. So yeah, you can actually assign a physical person to it, and where the physical person can continue with the conversation from here on.
That I was coming to, yes. Exactly.
Sorry?
I've seen this happening in many WhatsApp conversations where the bot is used, and when they're not able to solve the queries through the automated responses, it just redirects them to a live counselor. Okay.
Yes, yes.
I get your point. WhatsApp is more accessible to, like,
Yeah,
okay, thank you so much.
I hope I answered your question. Thank you. Any other questions?
Just want to add something on what Aishwarya shared for Nidhi and for other people as well. So like you said, like Aishwarya said, instead of searching the entire internet, this WhatsApp chatbot is just going to search the document for the answers, because every NGO runs their own program and have their own boundary conditions to what they want to share about their programs. So they can have their own knowledge base set as per the questions or the queries that the NGO has been receiving from their end users, and create like a knowledge base of sorts. And that knowledge base is like the main document for the chatbot to fetch answers from. So with time, people keep training the bot. Training the bot means looking at the knowledge base, editing things, and improvising the knowledge base, and eventually have a refined version of it, so that so that you have greater control on what kind of content is being fetched or sent to your users on WhatsApp chatbot. So that is something which is slightly different than just directly, either Googling or, directly using ChatGPT or Meta on WhatsApp. So, yeah.
And also talking about Sneha was another use case that we mentioned. Sneha is basically used for pregnant women pre and post delivery, where there is a not there no much awareness for pregnant women of what kind of vaccinations that they need to take at what kind of age before and after delivery, and what is the kind of diet that they need to follow and all of that. So Sneha is also a content delivery and a support bot, mainly for pregnant women. Um, there is a lot of work happening for the Sneha bot, hence we do not have the demo of the bot right now, but we will be happy to share that across as an email once we get the consent for the same. But yeah, any other questions, or shall we move forward?
We can move forward, Shraddha.
Okay. These are a few possibilities for the health sector on Glyphic per se WhatsApp chatbot that we have put together. So on the basis of a few examples that we gave that our NGO partners are leveraging Glyphic for our with respect in the same lines, we have put together a few use cases that could, come of help. And I'm sure a lot of people would be facing issues in the same lines. Let us know if you are facing any apart from these, so that, we can also keep these things updated. So one is definitely health alerts and updates, where, let's say recently we came across a very a bad outbreak, COVID, which was very devastating to all. So you can use WhatsApp. A lot of people used bot then to provide notifications, vaccination camp details about vaccination camps, and kind of steps that you need to take in order to, when you're in a quarantine, things like that, and how you can send reminders for follow-up care. Let's say there is a doctor consultation that has happened, and if the doctor has given you a 7-day medication list, so you follow up with them to understand if you're doing the gargling, or remind them that, are you doing inhalation, gargling, what is the schedule, remind them on when to take the medications, things like that. And 24/7 health information. Since it's a bot, there is no time boundaries to it. Let's say at 1 a.m. in the midnight, I'm having some kind of difficulties, and the bot can be used to give some kind of care information that can be taken at home for an emergency moment as such. Or it can also be used to notify the right professionals at that particular time. It can be used both ways. Digital prescriptions can be shared, and the CMHLP that I showed, the mental health support, can be used to understand what kind of mental health issues that an individual is facing, right? So since Glyphic, like Sneha mentioned earlier, is an open source platform, it gives you a possibility of seamless integration with multiple channels. As of now, we have integration with Bhashini, we have integration with Google Translation for multiple languages. We have integrations with Google Sheet. I'll talk about integrations in the next slides. Again, we can do health surveys. Let's say if you're an NGO who have multiple programs, to understand what is the kind of health condition in a particular village or in a particular community of sorts, you can use Glyphic to do surveys to understand how they're doing. And the first example that I showed, where they have created behavior with the help of sending them information on an everyday basis, Arogya World. So by delivering motivational messages or healthy habits on an everyday basis, it has made sure that a lot of people have taken care of themselves. So that is behavioral nudges. And multi-language support. So like I said, we have Bhashini and Google Translate that we have integrated it with. So we support most of languages that are supported. We support all the languages that are supported by Meta, and most of the regional languages are supported when it comes to voice and textual conversations.
Hi everyone, let's explore the Glyphic platform. On the right side, you'll find.
Sorry, it is an autoplay, but this is a small video of how the Glyphic platform will look like. I'll play this and then pause for questions.
All your chats. Click on any of the chats to view the entire conversation history. At the top right, you will find collections where you can group users and send messages to specific groups. On the left side, you'll see flow section where you can create and manage your chat flows. Here is an example of Glyphic's chatbot, which in this one you'll see how you can use drag and drop notes to build a simple conversation. You can include interactive features like buttons and lists. To test your flows, there's something called as preview tab, which helps you to build your flows, but not only to build your flows, but also test your flows. You can see translate here on the top. It allows Glyphic to auto-translate content into default languages of the flow editor and have the translations populated in other languages enabled in the Glyphic instance. These are the languages which are already here. You can add more languages in the settings section. On the side, you will also see Google Sheets integration. This is one of the most commonly used feature as NGOs work heavily on Google Sheets. You will find support tickets. So support tickets streamline the process of submitting queries and assigning staff members for each query. In the quick tools section, you can create interactive messages with button and list options and set up template messages for sending pre-approved structured message outside the 24-hour window. There's also an option for bulk applying these HSM messages. Now, if we'll move to the settings tab, you can configure your organization's name, enable multiple languages, and view third-party integration tools or third-party tools here. Glyphic is designed to be user-friendly, especially for nonprofits. It has a friendly UI and you don't require any technical skills to run the platform.
Any questions about the platform, how it works, or anything that you would want to know? Feel free to unmute yourself or put the questions in the chat window. Okay, I'll go ahead. So I was talking about integration features. So here are a few integration possibilities. Like we already mentioned that it is an open source platform. The integrations are not limited to this, but these are a few integrations that we have done till date. So ChatGPT and LLM is the integrations that we have done. Speech to text using Bhashini. Google Sheet integrations for data collections, where you can write the data into Google Sheets and also read from Google Sheets. Multilingual support, Google Translate integration. Data dashboard, we have something called as Looker Studio with the help of Google GCP, Google Cloud Platform, that gives you an overview of the analytics, basically how many people have access to your chatbot, who are those, their contact numbers, and then where they have stopped interacting with the flow, how is their engagement like with the bot, and what are the kind of issues that they are facing, the problems that they are inquiring. All of these details, you can get an overview of it with the help of dashboard, and send personalized content to different user segments. Like there is on the basis of the choices, the interactive messages that you have, we will be able to send in more personalized content because there is a profile creation that happens, and the bot remembers and logs the data that an individual has had conversation with, and then on the basis of that, it continues the conversation. These are a few features, integrations that we have done till date. And yeah, how you will benefit is we have 100 plus NGOs, a community of 100 plus NGOs who are leveraging Glyphic for the social causes particularly. And since it's a no-code platform, like you saw a video of the dashboard, it is very simple where, you write flows with the help of nodes, and then you connect the conversations with the help of arrows. So you need not have much of technical skills to run. And since it's a dashboard that's already available, it's easy to launch and pilot and see how you can scale it. And we provide support through a channel called as Discord, where all the NGO communities that are part of Glyphic are also present on Discord. So any queries that you might have, you can put in the queries on the Discord channel, and then we will answer your questions within a turnaround time of around 4 hours. We also have weekly support our calls and things like that. And extensive documentation. There is an entire documentation under help docs in our Glyphic website, which contains the entire process of how you will have to, how you can onboard to Glyphic, what are the first few steps for onboarding, and then what are the different integrations, how they are done. And yeah, we've been very much appreciated for the kind of documentation that we have put together. Please do take some time and refer to the documentation. Any questions so far?
No questions, Aishwarya. I can move forward.
Is there a Glyphic documentation available for Glyphic dashboard? Yes, there is. There is a documentation for Glyphic dashboard entirely on the help docs. I can share it with you after the call as well if you're not able to find it there. It should be there. If you're finding it difficult to find it there, I can share it across. Yeah. If Glyphic is the right fit for you is basically if you are, when we say engaging with 500 members in a community, why we say that is because if you are communicating with more than 500 people, then it means that you might be facing issues with keeping touch with them, giving them information. It might be taking a lot of your time. So yeah, if you are facing such difficulties, and if you want to personalize and keep in touch more and maintain relationship with all of your community partners, and yeah, then Glyphic is the right kind of option for you. Yeah. Any questions? Please do let us know. We're happy to take them. I hope that the language I used was, I know this is a little late, but I hope that the language that I used was understandable to all. If not, you can please stay back and we can, give you a simple explanation of things in Hindi, or yeah, we are comfortable with Hindi, Kannada, and English. You can stay back and then we can give you simple explanations of things in Hindi and Kannada if you're looking for it. Any questions?
Aishwarya, there was a question on setup. If someone is looking to set up Glyphic, what are
Mhm.
certain steps that they can take? Can you just briefly talk about the setup process?
Sure. Um, So in order to set up Glyphic, there are certain steps, very few steps, in order to have your Glyphic dashboard ready. One is that you need a phone number. This phone number need not be a special number or anything. It's just a regular phone number which needs to be active, which means that you would need to recharge this number. and it should not have WhatsApp pre-installed on it. So one phone number for the bot that represents the organization as a whole. And when I say represents the organization, it is not that you should have it for the organization. It should not be linked, as in you don't need to give in documents for the organization and get a phone number. That is left to your internal processes, but you can use any kind of phone number. The second thing that is needed is a Facebook Business Manager account. Since you're going to set up a business bot, you would need a Facebook Business Manager. Since Meta is handling Facebook and WhatsApp, you would need to have a business manager, and it has to be verified. So that is the account that you need to set up. The third step is Gupshup. So Gupshup comes in between WhatsApp and Glyphic. Gupshup is our WhatsApp business provider who's connecting us with WhatsApp in between. It's an intermediary software that we are using. So you should also have a Gupshup account. So if you have your phone number with you and ready, we can help you set up your Facebook Business Manager and Gupshup accounts so that you can have your Glyphic dashboard ready. We also have the steps that you need to follow and all of that in the help docs, like we already mentioned, if you would like to do it yourself as well. These are the setup processes. Any questions?
Just wanted to confirm if the phone number should not be previously used for a business account. That's what you said, or it should be.
When you say business account, as in you're saying that, could you
For
please?
example, our organization has already a phone number that we use for the business of WhatsApp business account. That cannot be integrated on that, you mean, or will
No, it should not have. So if you already have a business account, does it mean you already have a Facebook Business Manager?
Yes, yes.
So if you have both of these, then you would not need to bother take another number.
Okay.
We can continue from, if you
So
already have. Yeah,
sorry,
please.
just a question. Nidhi, you have WhatsApp Business or WhatsApp Business API? Is it WhatsApp Business app on phone?
Yes, it's a WhatsApp business app on phone.
Got it.
Yes.
Got it. So you can use the same number. You have to uninstall WhatsApp Business
But it
from
has to
your
be
phone.
connected to Facebook Business Manager. That's what you're saying, right?
Correct. So we will then, in that case, if you don't want to use the same number for your chatbot, for example, right? If you want to reuse the same number for your chatbot, then you have to uninstall it from your phone and use the same number for your WhatsApp chatbot.
Okay. And is there any cost involved for the pilot testing?
Yeah, we can actually talk to you about the cost now, Aishwarya, if you can just run us through the cost. And I mean, we'll just give you a brief about what cost is, but I mean, there's some dynamic cost, which is like WhatsApp fee and all. If you can also like tell us a little bit more about your program, we can send like a customized quotation to you or customized estimates to you, depending on your particular use case. So that is something which we can do. But yeah, Aishwarya, I mean, we can talk a little bit more about the cost overall, like general cost.
Sure. So the cost is also dependent on two models of operations. One is do it yourself and do it for me. Do it yourself is more of all like, since the platform that we have developed and we are developing, there are a lot of features that keeps getting updated, is a no-code platform and is very user friendly. You can build your own flows unless and until you have some other integrations that you would need, where you would need our help. We can help you, and we can charge it on the hourly basis that our product team spends on building that for you. Or if you feel that this is not something that you can take up and you want us to do it, want us to do it for you, we can do that as well. Again, that is consulting, and this is build it yourself. So, so Glyphic has four costs particularly. The one is the one-time setup fee is 15,000 plus taxes. This one-time setup fee is basically which involves all the Facebook Business Manager setup, the GovShop setup, and every setup that is involved in order to get your account up and running, have your dashboard ready. One-time setup fee will be charged. And then there is a SaaS fee, since it's a SaaS platform that we're providing to you. SaaS fee is 9,500 plus taxes, where you have multiple billing options available. One, you can go ahead and choose a monthly billing or a quarterly or an annually. Each of it has its own advantages. We can share more details with respect to the advantages over the mail. So the monthly platform fee is 9,500 plus taxes. Again, these two are the things that you'll be paying to Glyphic. Then, like Sneha mentioned, there are a few dynamic costs that are applicable. One is the WhatsApp fee, and the other one is the GCP fee, that is the Google Cloud Platform fee. Both of these are something that is whose bills are generated on the basis of your usage. So it's pay as you use. So we will link your account to the to GovShop and GCP, and we will create your own account on their platforms. So once on a monthly basis, depending upon the kind of usage or number of messages exchanged, the costs are put in here. On the basis of that, the bill will be generated. With specific to how we can, since we are working for the social sector and we want to make sure that it is utilized by as many people as possible, we have also asked our partner NGOs, and we have also come up with blogs that can help you understand how you can, there is a hack to reduce these messaging costs particularly. Yeah, we can share those blogs with you as well over email, where you can read through and understand how you can reduce messaging costs, a hack around it. These are the four costs involved. Any questions on these?
No questions for now. Thank you.
Okay. If there are no further questions, we also have some data to collect. That is, we want to know how you liked our webinar, and if you would want us to make any changes or add any further further information. Yeah, I'm just going to launch a poll. Please feel free to answer this. Please feel free to answer it very genuinely. It will only help us better our processes. We see only 1% out of 9 people have answered it. Yeah, we will share the webinar recording along with other resources that I just mentioned in a mail after this webinar. We also have a YouTube channel on Glyphic. Sorry, a YouTube channel on Glyphic on YouTube. Please do feel free to go there. We will also keep uploading our recordings there. So please feel free to go there and look through other videos that we have with respect to LLM integrations, other integrations, and things like that. You can just put in Glyphic on YouTube and you will get our channel. Yes, thank you. Thank you, Rodolphe.
All right then. Thank you everyone for joining in today. If you have any questions, I've put my email ID in the chat window. You can write an email. You'll also receive an email about the webinar with the recording, latest by tomorrow. So please, you can have a look at the recording, and we'll also share the QR codes as well, or the link to some of the bots from today. So yeah, thank you everyone for joining in. If you have more questions, you can stay back. Else we'll just close the call then.
Thank you.
Thank you.